A wonderful good day. I'm honored to be with my esteemed colleague and friend, Dr. Jamie K. Pickett. My name is Owen McCafferty, and we are bringing together ideas and thoughts through the kindness and the courtesy of professional fusion. This is part of, really, it's a five-part series. You heard the introduction already. And we are going to bring in four specific points. Our first point is basically taking the theory of Back to the Future and maybe exploring what happened, taking the good things, and maybe then realigning some of the things that need to be done differently. Just want to remember that our focus is going to be towards making sure that we have a set of foundation for what it is to be in a profession with a body of knowledge, a code of ethics, and a recognition by a state, commonwealth, or province, as we said in our introduction. Also, we'd like to bring out the idea that there were a lot of good things that happened in the past. We want to take advantage of those. But please remember a profession, specifically in the areas of veterinary medicine, dentistry, and dermatology are completely different than what they would be in a business as an occupation. And I hate to say it, but in an occupation, your biggest question is, what can we sell this schmuck today? In a profession, it's other center. So let's explore it. Let's go through it. Let's have some fun. This is part of a four-part series, and I would like to introduce to you my honored good friend, Dr. Jamie K. Pickett.
Good morning. Thanks for having me on. Yeah, you touched on a lot of strong points, and one thing you've always said to me is it's a body of knowledge and a code of ethics, veterinary medicine, and I really feel today many doctors feel the foundation shifting. I mean, ownership is changing, control is changing, the and not always in ways that serve the profession, that serve the veterinarians and the veterinary staff. And so we need to get back to having some consistency, and there's other ways to do that. Clearly, there's two ends of the spectrum right now. You've got corporate ownership, and you've got smaller mom and pops, and there's no exit strategy for people who don't want to sell to corporate.
You know, there are a lot of exit strategies, you're right. But you really did hit a hot point. And you're absolutely right. People perceive there to be limited opportunities to do things. And part of it is that first day that you start in practice, not even as an owner, but as an employee,
Mhm.
that maps out the rest of your future.
Yeah, yeah, you're right. Yeah, and I didn't stray too much from it. Well, a little bit, but yeah, it does. For most veterinarians, it really does. Where they start is where they end, and there's so many options that I just don't think they know about.
Um, let's explore some of those options. I really do think uh, people don't understand that you're in a profession. I'm in a profession as a CPA, but you're in a profession as a doctor of veterinary medicine. You also excelled by taking a master's in business administration. You've been in corporate activities, you've owned practices, you've practiced as an employee, you were involved with other much larger groups. You've seen it all, Jamie.
Yeah.
And can you tell us a little bit about what you learned?
To look at opportunities. And there's opportunities out there, and I think people are hesitant to look around, and you get very placated in what you do, and it's easy because it's routine, but there is so much more out there to explore, and you don't have to do the same thing you've been doing. And so I think for me, I just always took the door that was open, and you know what? If you don't like it, pivot. Try something else. You're not pigeonholed into one thing. So I think a lot of people, not just in our profession, but I think a lot of people do that. And so yeah, and you're networking, right? I mean, where did I meet you? How many years ago? And then you introduced me to people. I introduced you to people, and you keep networking and finding I mean, there's a lot of exciting stuff out there.
Oh, you hit the nail on the head. And see, that's one of the things that did not happen in the past, but
Mm,
is happening with a lot of ferocity. And that is that, well, you're burdened with being in a profession where it's 0.1% of the intellectual pool that gains admittance into a school of veterinary medicine.
hmm.
So it's problematic. You're with a lot of very smart people, and a lot is different than it would be in other professions. People don't think about it, but in some professions, it's pretty easy to gain admittance. It's not so in veterinary medicine.
True. And I think that that's a good point because I think because it's so hard to get into, people don't want to stray from it because they got in and they got through it and so I think that is maybe one of the reasons why they don't go to another profession or they don't seek things outside of practice and yeah. And it is starting to change, I think because of, social media and all these things that come up, it is starting to change to some degree, but not fast enough.
No, no, I have to agree. Let's go back. I remember back to 1976. Now, many people who are even listening to this conversation were nothing more than a twinkle in their mother's eye. But in 1976, that's when I started first working with doctors of veterinary medicine because we wrote a formula on value in veterinary practice. And I worked with, at that time, they called them Big Eight firms. But here's what I saw back then: very dedicated people. Uh, Small animal practitioners work 45 to 60 hours a week. Um, Food animal practitioners, at least 55 to 70 hours a week. And then our
Mhm.
old buddies, the equine guys,
Mhm.
oh my God, they just didn't, when they said they worked seven days a week, 12 hours a day, they're probably not being accurate. They probably worked 15 hours a day.
Right.
And they kept working harder and harder and harder. That's what the profession was when I saw it. In fact, small animal medicine was becoming predominant, but still there were a lot of mixed animal practices.
Yeah. Yeah,
There,
there needs to probably be more of them, but people don't want to do that anymore.
nope.
It's too much
Well,
work.
and then I'll look at the gender issue. I
Hmm.
remember the old days. There
True.
may have been
Yeah.
one or two women in a graduating class. I was at the graduating class in 1976 at the Ohio State University, where a very good friend of mine was graduating. Uh, and being a land grant university and being a very fine university, it was jammed up, and we were in the. They had the graduation
Hmm.
at the stadium,
Hmm.
and in the stadium, it was really an event.
Hmm.
And then it was something that would go back generations. It
Huh.
wasn't that you were the first one in your family to be a doctor, but maybe your uncle or your father, your grandfather, uh,
True.
also were doctors of veterinary medicine. So it was a lot different. It was very male, no question about it. And then in terms of ethnic issues, you were probably from a farm. So you're probably from either English or Scottish or German ancestry.
All right.
And you knew exactly what it meant to be a doctor of veterinary medicine. You lived for it. You knew it. You didn't have to study it. You didn't need to
Right.
have counseling. You were there A to Z, first to last.
Hmm.
Now, there was a lot of good that came from that in those days. There was certitude of what you wanted to do. There
Hmm.
was tradition.
Hmm.
There was an opportunity. You know what? You didn't have to worry about making a name for yourself
Yeah.
because your name's DVM or VMD, depends
Right.
on what school you graduated from,
Right.
pretty much said everything to you. But
Hmm.
it's so those were good things. And from one standpoint, it was kind of easy in the old days because you were always given a lot of respect.
Yeah.
And when you would say something, there was never a question. There wasn't an
Right.
internet. There wasn't chat, GPT.
Right.
We didn't have a people trying to play doctor. Let's
Right.
put it that way.
Right. Yeah, and to that point too, that was a good thing. And but nowadays, since we've humanized pets so much, I never minded when people would come in. I know a lot of vets get their feathers ruffled because the owner will come in or pet parent will come in and say, this is what I think is wrong and this and that. And they may be right, they may be wrong, but I think we need to embrace it and not, it's okay. They care about their pet so much that they educated themselves or tried to before they even get walked in the door. So I know people disagree with that, but I don't. I mean, as long as you sit and you work on a plan together. Okay, well, these are the signs and symptoms you're seeing at home, and they know better than anyone, their pet. And so I don't look at it as a bad thing necessarily, because they care. And so as long as you sit and work up a treatment plan together, discuss like why things would be important. I don't think it's a bad thing, but you're right. There's definitely not. It's a totally different world nowadays.
Well, that's the tip. Let's follow through on that because you always come up with some good things, but
Mhm.
that's really a gold tip. So instead of walking into the room and finding when someone says, well, it could be this, could be this, could be this, I
Yeah,
saw on ChatGPT, by the way, here's a printout. Instead of saying, well, God, who made you a doctor? Instead, you would say, that's a phenomenal thing. Let's go through it.
right,
Let's examine it. If you want, we can run tests if it's going to put your mind at rest
right.
as to what specific things, and that'll either confirm or eliminate. And what a wonderful thing. I want to say thank you, first of all, for having such great care of your pet that you would worry about it.
Hmm.
And let's take it seriously. But in addition to those things,
Right.
my experience has been that it's most probably this, or this.
Hmm.
Now, we can still follow through on yours, and I'm so happy that we would eliminate potential issues. But you got
Hmm.
to remember that sometimes on the internet, they go for the exotic, and often the very simple, plain to see issues that
Hmm.
I've seen over, gosh, 15, 20 years of experience
Right.
uh, is the real issue. That's
Yeah.
gold, Jamie. I
Hmm.
hope everybody, all our audience heard that one.
Yeah. Yeah. I agree.
So, so if we were looking back at what
Yeah.
was,
Yeah.
um, maybe from a
And
negative
bringing it
standpoint,
forward, but in a different way and rebuild the profession, professional ownership the right way, because somewhere along the line we strayed and we just need to bring it back. I
and
agree.
be
Yeah.
positive about it, and to
Hmm.
compliment the client, like you were saying,
Hmm.
which I think is a gold idea.
Yeah. Oh, it's
Second
important.
issue,
Yeah.
I'm sorry, I didn't mean to interrupt, but
No,
there's
no.
just so much we could be doing. It's so fun to go back to the future.
Yeah.
Uh, Second issue, when someone graduated from a great school, and when I started, there were only 26, and then they built it up to 28. And how many do we have now? Do you have any idea?
No idea. When I graduated in '03, there were 27. So I think
27.
so I don't know because they keep popping up, but they're not all accredited yet. So I don't know what you
Right.
count or not count, but I know there's obviously over 30, but I really don't know.
And that's just in the United States and maybe the Caribbean basin. That's not talking
Yeah,
about Italy. And,
yeah, and I'm just talking about the US. And I wasn't even including the Caribbean schools, which very legitimate. So there's two there, but yeah, I don't know, maybe 40. Still
and then
very
there's
few.
great schools in Canada, like Guelph.
Yep.
And you've got a lot of different options. And of course, you can go over to England or Ireland or
Oh, for
Scotland.
sure. Edinburgh has a great one. The
Yep.
Royal School of London has a great one. I actually looked at the Royal School of London, but I got into UF and it just made more sense. But it's a great opportunity. Yeah. But I don't know that everybody looks at it. It's accredited. I mean, there's no reason not to. They're,
Well, to be quite honest, sitting here in Ponte Vedra Beach, Florida, I think UF is a fine university to graduate.
Well, yes, it is. And because I went there, it's brought me back to Florida probably over and over again, multiple times, which are
That
very
was a wise
positive
move.
experiences. Mm,
Let me throw something else out. I remember going into a practice. Of course, it was always a trick to try to see, from my standpoint, a client, a
mm,
doctor, because they were working such long hours.
yeah.
And I remember going to a very close friend's practice in Indianapolis
Hmm.
and flying in, getting to the airport, getting a rental car, then going and waiting
Mm,
in the conference room for the doctor to finish a surgery. And this was occurring at 9:30, 10 o'clock at night.
mm.
And when I would walk in, sometimes I'd be allowed to go into the surgery suite. Of course, sterile technique and all
Sure.
those things have to be. Of course, they were a little bit different in the old days too. We have
Mhm.
to admit that. Uh, but they would have a book sitting on the side of a surgery stand, a stainless steel surgery stand, and there'd be a book that would be open up,
Right.
and they'd be doing the surgery, and then they'd be
Yeah.
looking over at the book, and they'd be doing the surgery again. And I'd ask them, I'd say, well, why do you have the book there? They said, well, this is somewhat of a tricky surgery, and I've never really done it before, but
Right.
I was up last night studying for it.
Yeah.
And then I saw patients during the course of the day, talked
Mm,
with clients, and then this is the time to do surgery. And we have 24-hour care, so we
yeah.
really could do surgery later on in the day. But when that book being open was a necessity because there really weren't a lot of boarded specialists that you could
Right.
refer cases to. But as a result of that, those doctors got to be really good at what they did. They
Mm-hmm.
were gifted surgeons.
Hmm. Hmm.
And that's part of it is that I see today, it's almost like we're going to the other end of the spectrum. People are so fearful that they may not do as good of a job is that they refer the case out. They never get a chance to learn to work the case up.
Right.
And I'm seeing some practices where that trend is changing. What have you seen?
Oh, yes. And I think the veterinary schools are encouraging them to send their patients to specialists for sure. And so, yeah, I don't think they work their cases up as much as, and since I was, again, graduated in '03, we did it ourselves. Everything, unless we really didn't feel comfortable. But yeah, there weren't as many specialists. I feel like I had a better body of knowledge because I did it myself. I didn't have a choice. There was nowhere else to go. So, and
Right.
you can call a colleague and somebody's bound to find out. But I think nowadays people just don't, they don't, they just punt. It's just easier. But you're
Well,
not
what
getting as much out of it. You're not seeing the end results. Or if you go back and get the specialist record, that's fine. But I think more things are being sent to specialists than need to be.
That's an interesting point. Could we
Mhm.
just dwell on that for a second?
Sure.
Because it seems like the larger practices that are privately owned, the associates get more exposure to
Mhm.
more difficult cases than they do,
Yeah.
let's say, in the large, they call them corporate practices, and they're not even corporate. They're just every practice is corporate. They're either an LLC or they're an INC.
Right.
But it seems like those larger entities that are either publicly traded or large aggregated practice groups.
Hmm.
So I hate to use the word corporates because that's not necessarily accurate.
Right.
But it seems like they're encouraged to refer to specialty groups within that family of practices uh, a lot more. Do you see that?
Oh, for sure. Yeah. And I think, you know, I do. I wish it just, I feel like that whole body of knowledge that you could still have, and there's a combination, you're creating something rare. You have trust with the client, trust between the doctor and the client, trust in the profession itself. I mean, and I feel yes, if you're not building on that body of knowledge by referring to those larger practices and whatnot, if that was what you were asking.
It's exactly what I'm asking. As a
Yeah.
matter of fact, that's exactly what I believe to be the case too.
Yeah, we went from
Uh,
black and white or muted probably footage of legacy practices, doctors with patients, handwritten charts, early clinics,
oh yeah.
and now we've transitioned into the slowly to modern high volume environments. And I don't. I'm fine. Don't get me wrong. I'm fine with electronic records and AI technology, and I believe in that part of it moving forward from handwritten charts. But the high volume environments, I think they're just trying to get churn patients out, and you're
So
not.
if you're in a larger practice,
Hmm.
you don't have to turn the patients down, do you? Because there's going to
Oh
be
yeah.
somebody around.
Oh, I agree with you with the large, yeah, with the larger hospitals for sure. Yeah. And you have colleagues
But
there, you have support systems. So, if you don't know something or you're not sure or you just want to have a colleague, you want to talk medicine. So, I mean, that's part of this, the smaller practices is that you're by yourself. You're in a you don't have any colleagues except for your paraprofessionals, but those aren't your colleagues. I mean, they're your
no,
support system and they're extremely important. It's just I wouldn't want to work by myself.
no. And that was one of the things in the old days. There were a lot of smaller practices,
Hmm.
but a good thing is getting into larger group practice, you have a chance to learn more.
Oh, for sure. Oh, absolutely. I would work in a large group practice any day of the week over the smaller ones or yeah, or obvious specialty, but I'm not a specialist, so but definitely the larger groups. And I think I don't know. I'm not really sh sure why people work in smaller ones, so I'd be curious to get more information on that. Just because you can learn more and do more, and so I'm not really sure, but yes, I agree with you with the larger practices.
Maybe we could follow up in the future and maybe get a hold of a couple deans, maybe talk
Mm,
with them,
yeah,
and then see what they believe. Do they teach the students in their first job to look for the larger practices or the smaller practices? We both know quite a few,
yeah.
and it'd be kind of fun. I can think
Yeah.
of some off the top of my head that would be really great.
Yeah, yeah, because I'm sure there's data out there too, like where they go. And I know there's a certain percentage that, obviously they go on to an internship and then obviously, well, some don't even go on in residency. They just take another year to hone their skills,
Right.
which, there's a percentage of that, but then out of that, take those off the table and how many go to small versus large. Yeah, I'd be curious. I think that would be a good next talk, maybe even after we get the data.
I I think it'd be great. Uh, so the other part I want to really throw is the issue of ethics and being in a profession.
Mhm.
Again, in the old days, I would hear at a lot of the meetings, AHA used to have, that's the American Dental Hospital Association, uh, would have quarterly uh, regional meetings, and those
Mhm.
were phenomenal. I really wish they would have bring those back. And people were different. Now, you see, I wear a shirt and tie and coat today,
Yeah,
uh, and
as
I've
you
been
always
doing
do.
that.
Yeah.
I do it. I've done that since first grade.
Yeah.
Coming from a parochial school environment, you learn these things.
Right.
But you go to a meeting, and I'm wearing a sports coat today, but that was considered dressing down.
Right.
And usually you'd see people with suits,
Hmm.
and they would conduct themselves as true professionals,
Right.
and they would maintain that status as a noble person.
Hmm.
And that that I think is something that was in the past. There really was the self-discipline because it allowed you to conduct yourself, reminding yourself that yes, you are in a profession.
Yeah.
And yes, there are certain things you got to do. And you have to worry about the benefit of the to the client
Hmm.
and in veterinary medicine and the welfare of the patient. It's
Right.
the only profession I know that has to worry about both.
Right. Yes. And I agree. When I dress the part, I feel more productive and I feel like I'm doing a better job. Because yeah, it takes time. It takes time to, prep and whatnot. And I do feel you're playing the part, you're playing the role. I agree.
So acting the part, being in a profession, adhering to the terms and the tenets of the profession,
Hmm.
considering yourself a professional.
Hmm.
And here's the big issue. What I've seen in the past, there was a delineation. You walk into a practice, you knew the doctors,
Right,
you knew
right,
the technicians, you knew the receptionists, the kennel
right.
attendants, the administrative people, everybody you knew. And
Yeah,
you knew them immediately by how they dressed and how they conducted themselves.
right,
I walk into a practice today, sometimes I don't know if I'm dealing with a doctor, with a licensed technician, with an unlicensed technician,
right.
with a, a person who's working at the front desk or a kennel attendant sometimes, because everybody has that egalitarian view. And I
Hmm.
think we lost something with that because, gosh, a doctor's opinion or a licensed technician's opinion, certified
Right.
technician, carried a lot of weight.
Right. Yeah. And I think that goes back to the when we discussed earlier about consistency is harder to maintain, continuity is harder to protect. And in some cases, incentives driving decisions are no longer aligned with the profession itself. So I think to be clear, change isn't the problem. And I think again, being part of a larger group, we can scale to bring resources. Structure can bring efficiency, innovation can elevate care. Yeah, and everybody's aligned and on the same page. But yes, consistency is just harder and harder. I agree. I don't know who's who in the clinics anymore. If I walk into a clinic I don't know who's who. So,
And there's an advantage because if you maintain your standing and you're readily recognized as being in the profession,
mm,
there is a respect. A
right.
licensed technician,
Mm,
his or her opinion
yes,
is very important.
absolutely. Absolutely.
And I don't think practices take advantage of that. I
No,
really
I
don't.
don't either. And then that's where I feel that the disengagement comes into play because they're not respected on the level they should be because no one even knows they're a licensed technician. Half the clients don't. They're not treated always like one because veterinarians can be controlling and double checking everything and believe in your
Sure.
people and engage them and empower them and we'll have less turnover. We'll have less this burnout that people talk about. I mean, it'll cut down on all that because your licensed tech doesn't feel respected. They aren't empowered to do what they were trained to do, and so they leave, and then you gotta hire someone else, and the cycle continues.
You know, you brought up another really good point. I remember people would stay in a practice for 20, 30, 40 years. They
Oh,
were
right.
part of it. That's a big change from what it is
Yeah,
today, where
it
it's
is.
it's
You need the culture. You need to keep the culture. I mean, it's everything. And I know it's probably an overused word, but it's true. They need culture, good, positive culture, and they'll stay. But yeah, but that's probably a conversation for another um
it is.
one of
It
these.
is. But when you start to see there's a lot of things in the past that weren't that bad, and we really do
No,
need to
no.
think about putting them in the future.
Agreed. Agreed. Some
Now,
things can be left in the past, but there's so much that can be brought forward. Yeah.
why, and I'm excited about the information-based opportunities through artificial intelligence
Yeah.
and generative large language modeling.
Hmm.
Uh, to gain information and knowledge, makes you a better professional at what you do.
Yeah.
I use AI every day,
Yep. Every
at
day.
least 2 or 3
Every day.
hours.
Yep. It's more efficient. So again, the past, keep so much of the good of the past and just implement some of the great things in the future, or you're going to be left behind. And right now, I do feel like the profession is fragmented.
Maybe it's a separate segment if we
Hmm.
can possibly. We have a couple mutual buddies, Dr. Dave Tack, Dr. Dennis Law.
Hmm.
Maybe we could get these guys to come online and give us some idea about what was, and Dr. Tack is still practicing today, and Dr. Law, I know lectures all over the place, especially in the area of surgery. When it
Hmm.
comes to TPLOs, the guy is a master.
Hmm.
Uh, but maybe it wouldn't be a bad idea if you would
Yeah,
be willing to host that,
that'd be great.
just to bring him in and just to see what they say.
Yeah, yes,
So,
very, very talented men, veterinarians. Yeah.
so we have a lot of things we can talk about. Your profession is just so fascinating. There's so much that which
Well, you've been
was
in it,
is
you've been in
good.
it longer than I have.
I've been in it longer than you've been alive, madam.
Yeah, yeah. I won't backdate, but I'm sure people can figure it out by the year I graduated. But yeah.
Well, they may or may not, because. But what I want to do is maybe just throw out this idea. This is the first of ours. Hopefully, some people got a tip, uh, that being enthusiastic, as you had mentioned, being complimentary to the client,
Mm-hmm.
taking the level of professionalism that occurs in the profession and celebrate it,
Hmm.
and have regard for your fellow workers, and to show true respect
Yeah.
to those that really have earned it,
Hmm.
uh, goes a long way.
Yeah.
The knowledge base, gosh, I remember, you won't remember this, but I remember where you would have x-rays and you would be
Hand dipping them.
processing the x-rays.
Yeah.
Yes, dipping. I remember when the big debate was, should there be an automatic processor brought into your practice? And I can't tell you the number of protocols in terms of anesthesia that I've seen.
Yeah.
Not the Campbell soup can with the ether, but I've seen a lot of changes that have occurred. We can really go back and maybe listen and come up with ideas. And a lot of times, practices will spend gobs and gobs and gobs of money on consultants coming in.
Yeah.
But rarely do I see a practice saying, well, let's bring in Dr. X who started this place. And
Right.
let's talk with him and let's see what he thinks or
Right.
she thinks.
Hmm.
And and maybe come up with some ideas.
Yeah. Sounds reasonable.
So there's a lot of things. There was one I meant to say. Um, there's a lot of things that are going on, a lot of changes that are happening, but I want to just maybe throw out an idea that rebuilding a practice, rebuilding what it means to be in a profession, uh, is the wisdom of seeing which was and taking advantage of it so you have something to deal in the future. What's
Yeah.
your view?
I agree. To move forward in a way that preserves autonomy, restores alignment, and protects the integrity of the profession for the next generation.
A great idea. From your lips to God's ears. So this is Owen McCafferty, and I'm honored to have my dear friend Dr. Pickett, and we will be bringing in more series. But if you just want to consider, go back to the future. Jamie, thank you.
Thank you for having me, Owen.
Thank
Bye.
you. Bye bye.